for the different presentations. That really does help a lot. I'm often searching for things, and it really facilitates our review of things. So thank you for that to the staff. The second is on the page 4 of it, there's a word double, which is the word effects. It's under the point 2 under item 9, second line. The Woodleaf study presented mostly no effects data. Effects not, it's like the word effects 3 times in a row there. So I think the second effects could be deleted. No effects data is probably okay.
No effects data will suffice. And I wrote that.
Otherwise, it looks fine. You wrote that?
I did write that. I edited what had been written previously.
To add another effects in.
Unintentionally. I think it had said negative data in the draft, and I wanted to make it wasn't negative data, it was no effects data, but
right. Okay.
We'll make that correction. Others? All right. Well, we have a motion to adopt the August minutes with those 2 edits. And I heard Elena move and Dave second. All in favor?
Aye.
Any opposed? And I will abstain because I wasn't present. So we'll make those couple of corrections and we will get that posted to the website where the reporting already has been posted. So with that, I think we are on to agency updates. Assistant Secretary for the Environment, Sushma Masemore, is out today, but we're joined by Michael Scott, the Director of Division of Environmental Qualities, Division of Waste Management, who will give the remarks on behalf of DEQ. Good morning, Michael.
Morning, Mr. Chairman. Morning, members of the board. Would like to thank all the DEQ colleagues who worked on preparation and response efforts for Hurricane Ian, and for those who are handling follow-up items over the weekend. Luckily, we didn't face some of the major impacts we have as a state from previous storm events, but appreciate all of that collaboration across multiple state agencies. On the PFAS front, we did...
Michael?
Yes.
It's a little hard to hear.
I'm sorry. All right. On the PFAS front, DEQ did issue the discharge permit for a treatment system to remove PFAS compounds from contaminated groundwater at the Chemours Fayetteville work site. This was issued back in September on the 15th of the month. The treatment system is part of the larger barrier wall remediation project to substantially reduce PFAS entering the Cape Fear River and impacting downstream communities. The Department's Division of Water Resources issued the NPDES permit for a granular activated carbon filtration treatment system. And after the consideration of public comments and further review of data and information contained in the permit record, the permit limits for the 3 indicator PFAS compounds, those would be GenX, PMPA, and PFMOAA, as required by the Chemours Consent Order Addendum. Those indicators, the permit limits for those 3 indicator compounds have been significantly reduced beyond the 99% removal previously required in the Chemours Consent Order. These limits now represent an estimated removal efficiency of greater than 99.9%. The NPDES permit also includes weekly monitoring upstream and downstream of the treatment system during barrier wall construction to track progress and efficiency. It also allows for evaluation after 1 year to incorporate new data and further tighten limits if appropriate. The permit can also be reopened to add limitations based on new toxicity data, introduction of federal or state PFAS standards, and if other PFAS compounds break through the treatment system more quickly than the 3 current indicator parameters that were just noted. The massive remediation project is one of the largest of its kind to address PFAS. The system involves a mile-long barrier wall, an underground wall up to 100 feet deep, more than 70 groundwater extraction wells that will remove the PFAS contaminated groundwater prior to the wall, and have it pass through the granular activated carbon treatment system to intercept and treat that contaminated flow from the facility. The groundwater ultimately will be treated and removed at a removal efficiency, as noted, of 99.9% of PFAS compounds before being released into the river. Currently, this This contaminated groundwater flows untreated directly into the Cape Fear River, and this project is designed to reduce the largest ongoing source of PFAS from the Fayetteville work site that's currently impacting the Cape Fear River. And it must be operational in accordance with the consent order by March 15th of 2023. DEQ also issued an approval letter for the final design of the wall, as we just mentioned, that 6,000-foot wall. The approval also includes conditions for adding additional monitoring wells, sampling of those groundwater extraction wells, and management of contaminated groundwater during barrier wall construction. So as we talk about the Fayetteville work site, one of the major remaining sources of PFAS and the major source that's impacting the river, this is a major remediation project slated to be operational by first quarter of next year. So a lot of great work on this across multiple divisions in DEQ, and glad to see it moving forward. In regards to the Division of Air Quality, that division continues to review stack test data from Chemours in response to a testing schedule that was included in the April 5th, 2022 settlement agreement. Additionally, there are measures being implemented this month at Chemours to further reduce air emissions. These measures were specified in the April 5th, 2022 agreement. And the Division of Air Quality will continue to assess emission control performance through regular stack test at the facility and the collection and review of environmental data nearby the facility. As we also talk about some of the efforts in the lower Cape Fear region that have been impacted from PFAS coming from the Fayetteville work site, DEQ plans to hold a community meeting on October the 11th at the Roland Grice Middle School in Wilmington, North Carolina. Provide the lower Cape Fear residents updates on the remediation efforts at the Fayetteville work site in Bladen County, but also update them on the ongoing private well sampling in the lower Cape Fear region. A brief note on that front, there are now about 270 residential wells in the lower Cape Fear region that have been impacted from PFAS through the Chemours private well sampling. Those include the counties of New Hanover, Brunswick, Pender, and Columbus counties. There are about 1,200 private well sampling results that have currently been received by Chemours and being reviewed by DEQ, and about 3,500 lower Cape Fear residential properties that are eligible for private well sampling, and about 33 residences that now have levels of PFAS detected in their private well above the EPA health advisory level of 10 part per trillion. So a lot of ongoing work, not just around the plant with remediation efforts, but a lot of effort for private well sampling and to address exposure in that region. On a final note, the Division of Water Resources has also initiated a monitoring effort across North Carolina on 50 public water supply systems that have tested levels of PFOA, PFOS, and Gen X that warrant further sampling and efforts. DWR has finished the first round of 3 rounds of testing of raw and finished water at these systems, and will be completing the testing at the end of November of this year. So as you can see through these PFAS updates, there's not just a lot going on related to the Chemours and Fayetteville work site there in Bladen County, North Carolina, but a lot of work underway through DEQ and the implementation of our PFAS strategy as an agency. And as I mentioned, the additional sampling by DWR on these public water systems. So thank you, Mr. Chairman, board members, for letting me provide the updates today.
Thanks very much, Michael. We were going to get an update later on the consent. Hang on just a second. I'll see if people have any questions. We're going to get an update on the consent order studies for the toxicological aspect of PFAS in North Carolina from Dr. Nilsson later. But I appreciate the update on all of the exposure information and the institutional controls to limit exposure, as well as the remediational controls that are in progress. We do have time for just a couple of questions, and then we're going to limit it to that so that we can take advantage of people's time on a couple of action items from DEQ presentations. Are there questions for Michael? Any?
Thank you, Mr. Chairman.
You're welcome.
I have 2 questions for you. The first is, you said that the new system will be in place by March 2023. From now to March 2023, is it business as usual, or what is the status of that?
Right. Between now and March 2023, Chemours will be utilizing a DeWind one-pass trenching technology to install the barrier wall. The actual implementation of that barrier wall construction will be occurring. The finalization of the groundwater extraction wells, those 70 wells that are being put in to remove the groundwater, then pass it through that granular activated carbon treatment system will be installed. Far as what's going on right now, the consent order addendum required other controls for PFAS making its way to the river, and those controls are already in place. One of the main ones was the seeps, or where groundwater actually surfaces at the facility, flows like several streams to the river. There's in situ treatment through granular activated carbon of those seep areas. So those measures have already been implemented. This is the main and last significant effort to address groundwater before it impacts the Cape Fear. So a lot's already been done. To answer your question, this main barrier wall remediation system will be operable by first quarter 2023.
Thank you. And my next question to you is, how often do you make measurement of breakthrough of PFAS or the three compounds of coming through the activated charcoal system? Or how do you ensure that you have not reached the breakthrough point, because all three will have different values associated with it?
Right. The short answer there is through routine testing that Chemours will be required to do. DEQ also collects samples. To your point, we do see differences on breakthrough based on carbon chain length. We even see it on the private well treatment side. So it is something we have to monitor, from your longer carbon chains to PFMOAA and other compounds that may be a 3 or 4 carbon chain length. So the answer is by continuous monitoring, not only the requirement of the responsible party, meaning Chemours, but also follow up through our state oversight as DEQ.
Thank you.
Time for one last question. John?
The 70 wells that are doing pump and treat right now, are those all within the perimeter of the facilities?
Yes, they're all within the facility. Good majority have been installed, but they're not up and extracting wells already. There's a limited number where groundwater is already being removed, taken off site. The 70 are not fully operable as of yet.
And how deep down will those go?
They go into different aquifers. I don't have that right in front of me.
Okay.
I can follow up with you on those depths.
Okay.
But they will ensure that you don't have groundwater actually backing up, if you will, behind the wall. They will remove it to that 100-foot depth and possibly even beyond. But we'll be glad to get you those depths. I don't have them in my notes.
Okay, thank you.
Thanks very much.
Thank you.
We appreciate it. We have an opportunity now for an update from North Carolina DHHS. I see Dr. Zach Moore approaching. Zach's the state epidemiologist and epidemiology section chief. Good morning.
Good morning. Can you hear me okay?
I can, thanks.
Okay, thank you, Chairman Augsburger, members of the board. I will be brief, and I'll start off as Michael did, with adding my thanks to all the staff that participated in the response to the aftermath of Hurricane Ian over end of last week and the weekend. Hopefully everyone is recovering, those who lost power, et cetera. In terms of our updates around PFAS, one thing to note, we did issue an updated version of our clinician guidance last week, I believe, possibly the week before. This was updated to reflect new recommendations that came from the National Academies, including Dr. Hoppen, who we'll be hearing from later, who participated in the National Academies review of clinical recommendations around PFAS exposure and monitoring of levels in clinical samples. So we incorporated a lot of the guidance from the National Academies. Excuse me. Also, we added some additional information specific to compounds that are more specific to North Carolina and specifically to Chemours that were not included or not addressed in the National Academy's recommendations. So some discussion of that as well. So that has now been shared widely and is available on our website as well. On other topics that may be of interest, we've spoken or talked with this group before about some of the wastewater monitoring efforts that are run largely from our occupational environmental epidemiology branch. Dr. Guidry, who's with us today, also with our our state lab section in environmental health. That was implemented for COVID initially. That work is expanding, and we're now taking on some of the testing in our state laboratory of public health, which has been, the initial testing was all done with our academic partners. We're also have expanded to include testing for some other respiratory viruses. Respiratory syncytial virus, which is a respiratory virus that can cause severe illness, particularly in young children, infants, and in the elderly, is now being monitored in some of our municipal wastewater locations, and we are now added, I believe, flu, starting to add influenza detection there as another source of information about circulating respiratory viruses and sort of a early warning detection system that can help us understand what may be coming in terms of illness and impact on our healthcare system. And then one other item that I will mention, there was a lot of activity around environmental justice over the past month with the 40th anniversary of the Warren County protests and the what's considered the birth of the environmental justice movement. We at DHHS, again in the Occupational and Environmental Epidemiology branch, have been continuing to work on an environmental health data dashboard that we recently received some support from the Centers for Disease Control and Prevention to help create a place to pull together exposure information and specific health outcome information. So that we have I don't know if we're calling it a beta version, but we have a version up on our website for comments. And we also had the opportunity a couple of weeks ago to get a guided tour of a new environmental justice index tool from CDC that's been recently released, that is an attempt to sort of collate information about cumulative exposures and certain socioeconomic factors and health outcomes to help give a sense of areas of the country. This is a national level effort that's done on the census tract level, areas that are disproportionately impacted or where there may be disproportionate impacts from environmental exposure. So just noting that tool that's also available, not from us, but from our federal colleagues. And I think that is it. Happy to take any questions you all may have.
Thank you. We'll pause for a couple of questions. We appreciate it, Zach. Jamie?
Just wondering if you had any updates on monkeypox.
I do. And I was going to spare you all, but since you ask, monkeypox continues to circulate, unfortunately. We have seen a leveling and now a declining in the number of cases, but we're still seeing quite a bit of transmission, and it continues to primarily impact men, and gay and bisexual men who have sex with men still constitute the majority of our cases. We're also, unfortunately, still seeing disparities by race, with about 70% of our cases occurring in people who are Black or African American. So we are continuing our efforts to get vaccine out. There is the Jynneos vaccine available that we have been is available currently only through the federal government, and we are working to get that out as widely as possible with a focus on equity and trying to reach the populations that are being disproportionately impacted currently. So that's taken a lot of forms. We also are working on treatment access. There are no approved treatments specifically for monkeypox, but there is a drug that was approved for smallpox treatment that appears to have effectiveness in limiting or preventing some of the more severe consequences of monkeypox infection. There's been only a very small number of deaths globally, but the infections can be very painful and can result in permanent scarring depending on the location. So, so treatment access is another big focus.
Thanks, Jamie. Thanks, Zach. Any other questions? Elena?
I'm just wondering, and this is probably more directed to Dr. Scott, what happens to the granular activated carbon that once it's heavily laden with PFAS? I mean, what do they do with it?
That would definitely be better for Michael Scott.
Thank you for the question. There's several different materials that obviously leave the Chemours facility and go for proper disposal. Subtitle C, hazardous waste landfill, deep well injection at hazardous waste site in Texas. Most of the carbon goes for regeneration. So Calgon is one of the main distributors in the United States. They're able to regenerate activated carbon and put it back into use. From our conversations with Calgon, as we look at this full cycle of treating PFAS, that taking that filter or treatment media, where does it go so that it doesn't lead to a secondary impact? When they do regenerate the carbon, they don't put it back in a drinking water scenario. It goes for another wastewater or other type of treatment. So the short answer is it's regenerated. There are some waste streams, including carbon at times, that Chemours will send off-site for what we call Subtitle C, or hazardous waste disposal. So I hope that answers your question.
Thank you.
Thank you, Michael. Thank you, Zach. We're about to move into the action item portions of the agenda, to be followed by some updates. John Vandenberg has reminded me in the past, though, and I didn't forget it this time, that it's a good practice to check in with the people who've asked to speak, to learn what topic they're speaking on, and if we can accommodate it along with the topic. It's sometimes better to do that than wait till the very end of the meeting for the public comment section. The only one that has signed up, according to my peek at the sheet just now, is Michael Waters. And I'm not calling on you yet to talk, Michael, not surprising you. I just wanted to check in with you. If your comments are directed toward PFMOA specifically, we could make time earlier rather than at the end of the day, or the other agenda item has to do with the bioaccumulation factors. If it's okay. Thanks a lot. I appreciate it. So with that, then we'll move into action item number 1, which is the PFMOA recommendation. Just a little bit of history on that to bring everybody back up to speed, mostly bring me back up to speed since I missed the last meeting. PFMOA was one of the compounds that was identified following the state synthesis of exposure data and toxicological data for PFAS in North Carolina. Dr. Nilsson compiled a spreadsheet and database of the available data for PFAS in surface water, groundwater, biota, human samples, and then had a column in those data about which ones were for which ones there were available toxicological data. PFMOAA was one of the compounds that was detected frequently in surface water and groundwater. That initial indications indicated there was some toxicological information available, but it wasn't one of the ones that EPA was going to move on with their own health advisories. So it became one of the priority compounds for the state to look at to fill the gap. It's important exposure-wise locally. It's not going to be the subject of somebody else's rulemaking, and so it needs to be a focus here. So that's what got us here. And in June, Franny shared 2 studies that she had retrieved from the literature. In August, you all had a discussion of those, and I circulated a draft summary of that discussion to try to pull together a concise summary of what people discussed for the benefit of DEQ, the client in this case. So that's where we are. When I listened to the recording and helping Franny prepare the written summary, I noted a deep dive into one of the two studies, the Woodleaf et al. Study, not as much of a dive into, or at least not necessarily overtly into, the Yao et al. Epidemiological study. So I'm going to propose we move forward with 3 steps to take any comments on the Yao et al. Study, and then pause. If there's not any, we'll move into a review of what's on the screen now, which is the written summary, to see if we can come to consensus on that. It's not necessarily important to come to consensus today, but we have time to work it a little bit. And then third, is there anything else between the data that we have and full whole animal studies that we will get an update from Franny on that would have been sufficient information so that the state could potentially seek some interim measures for deriving reference doses? Does that sound like a reasonable path forward to take those 3 steps? Any further comments on one of the 2 that we were asked to review? Then look at our summary and then look to see if we want to add anything about other steps that could be taken. All right, then here we go. The Yao et al. Study, my take of it is that it was an epidemiological look at 13 perfluoroalkyl ether carboxylic and sulfonic acids in 977 serum samples from a production facility in China. The paper examines the concentrations of those 13 PFAS that includes PFMOAA, examines those in terms of how they differ by gender, how they differ by age. And 311 of those samples had co-occurring analysis of I think it was about a dozen routine biochemical screenings. And then the paper's, I guess, epidemiological aspect is looking at the association between the magnitude of PFAS, individual PFAS, and the biochemical data for those 13 samples, 13 endpoints. So with that summary, I'll open the floor for any commentary. And again, the charge question here that's on the screen is DEQ identified the 2 studies, one of which was well evaluated last time. The other one may have been included in people's summary statements, but we didn't mention it overtly. Any concerns about the quality of the study? And then also, does it present an adequate information base with which to derive a reference dose? And the floor is open, and we'll spend about 20 or 30 minutes on this topic, including all 3 of those subtopics that I mentioned. John?
I think it's best if we talk about the 2 questions separately, actually.
Okay.
The start of the first one, I mean, my review of the 2 studies where they both were very well done, well documented. There's always questions you can raise about studies, but none of them struck me as being notably deficient. I was impressed by both of them, actually, in some ways, in terms of the extent of information that was collected, the sample sizes, dose regimes, and endpoints measured. So I don't have any concerns about either one of the 2 studies, is my view.
Okay. And again, we're going to focus on the Yao et al. Study because the Woodleaf et al. One, there was a fair amount in the verbal record.
That's right. I'm saying that about both those.
I got you. That helps. Thank you. Jamie?
So I wasn't here for the discussion last month, or in August, but with respect to the Yao et al. Paper, I think their focus on cholesterol and liver markers is very valuable because some of the data that have emerged for PFOA and PFOS regarding, and this might have been part of the discussion, I apologize. Some of the data emerging regarding those markers have become a little stronger. There is a publication that came out in 2022 by Costello et al. That evaluated epidemiological and toxicological studies concerning non-alcoholic fatty liver disease and elevations in liver enzymes for specifically PFOA and PFOS. And in the conclusion of the paper, the authors indicated that the weight of evidence for non-alcoholic fatty liver disease in association with PFOA and PFOS exposure may reaching causality. So I think deriving a reference dose from these human data with the support of some additional studies to select this critical endpoint is rational and based on good science.
Thank you.
And so I think this is a well-conducted study as well.
Great, that helps. Others? There were a variety of lipid panel parameters in the 13 that they measured. The only one for PFMOAA that was statistically significantly different was glucose. It was negative for all of the triglycerides, HDL, LDL. And then I think any comment on the secondary part then? We've talked about study quality or relevance, which we did. Adequacy as an information base with which to derive a reference dose specific to Yao et al. As opposed to the two studies combined.
So can I ask a question? Is in the absence of deriving a value, is the assumption that the value is there's no mechanism for trying to control, to reduce exposures? What happens if you don't have a reference value?
I don't know the answer to that. I think, all of those are tools for regulation. I don't know whether or not it means that there isn't any or they default to something else. Are there folks here from DEQ that know the answer to that? What's the alternative to not having a reference dose?
I mean, isn't the reality right now the cleanup that's occurring is going to cover this class of compounds as well, right? So it's not like
Absolutely.
nothing's being done. I guess the broader issue is whether or not a drinking water standard could be applied more broadly, right? I mean, to me, that's a broader question.
Or a science-guided one to know whether or not it's appropriately driving environmental management, high or low. But yes, Franny, please.
So I can answer part of that, and I think the standards question is probably better left to one of the division directors. But in absence of a reference dose, we're trying to figure out what else we can do and how we can utilize the information that exists to have a scientifically supported value for these PFAS that there are very little toxicity data for. And so we've previously talked about using these new approach methodologies that the EPA are developing. And that conversation is ongoing. And so it's not on the agenda today, but we are in close communication with the computational tox group at the EPA and looking, I guess, into the future and how we can use those methods in this kind of an application. And so it is, the conversation is in its nascent stages, but it is occurring. And so we're exploring those things right now. That's the best answer I can give, I guess.
Well, if I might ask then, I think it's the combined information that's actually informative in setting a reference level. And I'm glad you mentioned about the, whether it's computational chemistry or the other approaches that have been, new approaches been used. So a single study oftentimes isn't taken by itself. It needs that accumulation of information. So I guess the question is whether these studies by themselves is what we're being asked here, right?
It's my understanding that these are the only two that retrieved from the literature for PFMOAA. So you have a target compound, exposure information. This is the extent of your toxicological information at this time, although the compound is subject to a consent order study. And DEQ has asked, with these two studies, do you have enough for a reference dose versus, continuing to keep it a compound of priority, but waiting for additional data?
And is the expectation that additional data will be coming from the EPA's computational chemistry group or others?
That's part of the conversation we're having with them right now is that the compounds we're dealing with, there's very little data for, and there are a few that Chemours is required to do toxicity testing for, but not all of them.
Is PFMOAA one of them?
It is.
It is. But that's probably 2 years out?
Yes.
Okay.
Jamie?
I am working on a manuscript that does include a different dose range for PFMOAA, along with detectable serum concentrations in mouse models. But I also wanted to point out too that when we're evaluating effects of various compounds in people and other living organisms, are we bound by the statistical significance presented in the manuscripts, or can we accept that there's a biologically active change and use that maybe for benchmark dose modeling in the absence of an identified NOEL or LOEL in creation of a reference dose?
We can and have done
Remember.
that with Gen X. We looked at the raw data, did benchmark dose modeling of a variety of different endpoints, and looked across all of those before endorsing one number.
I think trends can be very informative. It doesn't have to be statistically significant, in my view.
I agree with that as well. I feel like a lot of the biomedical science that I was exposed to throughout my career in education, it's not always statistical significance that's important. And often it's the use of non-parametric statistics or different kinds of population statistics that show whether or not something's effective or worth implementing. And so for environmental data or classical toxicology data, we use these very stringent statistics, but that might not be the only thing to consider.
So for the Awodal study, though, to put a finer point on it, although there was a statistically significant change in one parameter, glucose, and not for the others, their experimental design there for those 300 samples for which you had matched PFAS data and biochemical changes wasn't even individual correlation between those. It was dividing all the PFAS data into 3 bins, using the lowest third of the data as the control, and seeing if there was a change in the biochemical parameters between the lowest and the highest of the 3 bins. So knowing that, I would invite feedback on the second question here relative to DEQs want to know whether or not that is an adequate information base to derive a reference dose.
So I guess is DEQ proposing that the point of departure would be the data from the OWL study for glucose as an outcome? Like, would that be the plan? Because if it is, I mean, I'm not very comfortable with that, to be honest. I don't know that that's the biological relevance of that endpoint as a standalone study to really have the entire assessment based on that. I think there's not a lot of supporting data for that. And obviously, there's not a lot of data, period, which makes it challenging. I mean, but we have to be pretty cautious, especially with ClinPath data. I mean,
We're not proposing a point of departure. It's, I guess, what the studies use for their endpoints is what we're asking about.
but if you're not picking a point of departure, then then how would you derive a reference concentration for this? I mean,
It's my understanding they're not doing it, unlike, so like with Gen X, DHHS had an approach that they asked us to review. And with methyl bromide, they actually had a reference dose and then an extrapolation from that they asked us to review. In this case, it was, is there enough data here for them to move on in deriving a reference dose? To Jamie's point, potentially any scientifically valid means that the board could recommend to them, is this enough? As opposed to they've proposed to bring something from these 2 studies. Does that help?
No.
Sorry.
No, I mean, it doesn't help because there's no analysis plan that's being proposed and saying, on face value, could we maybe mine this data to come up with a number? That's basically the question. And so I guess the theory is you might be able to, but I mean, broader, the question right now is by itself, is that paper strong enough to do that? And I just don't believe it is.
And I think the only thing that I would change is the two papers is, are they enough?
But are there concordance between the two papers, right? So the biological concordance does become part of the question.
You bet.
So maybe we're doing this in backwards. We should be talking about the other study first to find out what the real linkage points are and then come back to the epi and ask is there concordance.
Jamie?
So not to jump the conversation to the Woodliff et al. Paper, but there were changes in liver weights and there were changes in some liver enzymes in that study that could provide underlying support for perhaps the selection of non-statistically significant liver weight or liver enzyme changes in the Yao et al. Study. So there is biological plausibility that PFMOAA, in addition to other types of PFAS, can have effects on the liver.
But, okay. And there's known species differences between rodent and human responses with respect to those outcomes. So again, that doesn't, I'm not saying that's not a plausible way to go. It's just when you're really data poor, you have to be cautious about how many inferences you're trying to make.
If you're talking specifically about peroxisome proliferation and levels of peroxisome proliferation driven by PPAR alpha, there are several elegant studies that have been connected with humanized PPAR that demonstrate effects on the liver. And then in terms of liver weight increases, I don't know if we've observed those in humans, but changes in the liver period between rodents and humans. I think the toxicological and human data are supportive of one another, even though there may be changes in individual parameters evaluated.
Other perspectives? Then I'm going to move us, thank you, Franny. I'm going to move us on to the text that I emailed out, which is a draft. The DEQ management has asked for a written summary of the recommendations to their two charge questions. The two charge questions are written there. We've added some additional consideration of the Yao et al. Paper, at least overtly, to fold into that. Are there any suggested edits to this summary? And it's on the screen as well, and we can scroll down a little bit, perhaps, Peter. Great. So everything below what's visible on the screen is simply where you can go hear the conversation, and then the references. Everything above the middle of the screen is verbatim the charge questions that DEQ brought to us, and our job is in the middle. And I guess, I would characterize it as DEQ is asking us, are these two studies an adequate information base for them to go back and examine deriving a reference dose? In other words, is this enough? Would we endorse, yes, you should spend the staff time to go ahead and explore calculating a reference dose, versus it's somehow inadequate and additional data will be needed, which is where it ended after last go around. I'm simply pausing to fold in the additional study and give people a chance to think about it again. It doesn't have to be crafted today, but we have time to hear any feedback about the summary. And ultimately, we will have a written summary. So the floor is open on suggested edits to the summary. Jamie?
So I think, we have to weigh the need to derive a value that is needed for public health protection with the available database. And two papers is pretty slim in terms of a database, even if the papers are of high quality. And if there are concerns with the concordance between the two studies as being sufficient for driving a reference dose derivation, then we need to be explicit in stating those concerns. But I think we also need to keep in mind the need for public health protection. And if these two studies are of high quality, and if the data are amenable to reference dose derivation, then we also need to include that in our recommendation. So maybe something that we could add at the very end of that last sentence is that, you know, these studies are not appropriate from which to derive a reference dose for PFMOAA with current guidelines and approaches for deriving reference doses, because those typically have, I think, a deeper and richer database requirement. But there's nothing that says you can't derive a reference dose from only one or two studies. So I think the issue is whether or not if a reference dose is calculated from only two studies, are the studies strong enough so that that decision is defensible?
I'll say these two studies as opposed to, they didn't ask us the question generically, are two studies adequate? They asked us specifically, should we spend more staff time on these two studies? So how would you rephrase that question at the end to these two studies?
Well, again, I think we need to say with current approaches, you know, that they might not be strong enough with currently utilized approaches for deriving reference doses.
All right. Other perspectives?
Do we have a point of departure for each of these studies? Because the last sentence says that we are finding that they're not consistent, but I'm not sure I know what the point of departure is for each of these studies.
It'd be hard to get one out of the second. I guess you'd have to take, you know, the median of the control group as your.
The way the sentence is, it indicates that we do have that, as though we've actually looked at consistency, but I don't think we've actually done that.
So do you have a suggested edit?
Well, I think it's the last sentence could be these two studies do not provide an adequate foundation from which to derive a reference dose. I don't, Jamie, you had some addition there at the end of it. I'm not sure I quite follow.
Oh, I
you
was
ended up on that. Yeah.
With current approaches for deriving a reference dose, such as guideline approaches that have been published.
Okay. I don't think the state has a guideline. I mean,
Well, I think if they follow US EPA
Yeah, EPA.
recommendations and guidelines.
yeah.
So
There's also provisional values that EPA has derived. It's called provisional peer-reviewed toxicity values, PPRTVs, which also again has a process for those chemicals that have less complete data sets. Oftentimes those are used. It's not just the reference doses, it's reference values that can be derived as well. California has approaches, Texas has approaches. So
maybe we should include that in the recommendation to explore some of these other
the other approaches.
approaches.
Yeah, but actually, my familiar with the other approaches, it still would say that it's not adequate.
And to the extent that we can cut to the chase, that's probably helpful to the state. I mean, as you've heard from the updates, there's a lot going on with PFAS. There's consent studies. They're aware of ongoing research and trying to be. I take this as a very pragmatic question, which is, should we spend staff time to take these two studies, which were the two that we could find, and start working on a reference dose to bring back to this board, or would this board say maybe pause?
I would pause. I don't think it's enough there to do a lot of modeling or anything really on that, in my view.
Elena first.
And maybe in the summary, and I'm not sure, I'd have to think about what the wording would look like, but something about are there any suggestion about biological plausibility of effects? I think it's leading in that direction, but you know, again, it's not as sufficient in an information base in and of itself.
These two studies.
Yeah.
And that I heard Jamie add that part for biological plausibility is that both of them have plausible endpoints. So, but one of them doesn't have a point of departure. But we also heard they maybe need not be consistent. Jamie?
And I also have raw data from another PFMOAA study that is, I'm in the process of combining two different compounds together into one paper to get the paper submitted for publication sooner. Those data are potentially amenable to dose response modeling. There's also, we've identified a low L and a no L, even though the low L is the highest dose administered, for an immune system endpoint for PFMOAA. And we also have serum data that would go along with that.
So I think that kind of additional information would be very helpful to have, as well as, and again, anything from EPA about the computational chemistry. You need that whole set of things. What's your timeline on that? Do you have a sense?
Well,
You're late. You're late.
I've received several nudges to get those data out and submitted. It's just, give me 5 days of complete uninterrupted time.
I'll give it to you.
Yeah.
The power and, yeah.
Well, to the point about the value of the reference dose being science-guided calibration of what a regulation should be, or an advisory or a guideline should be, knowing additional data is coming, I think does speak to the practical question the state is asking, which is, do we have enough now to start moving on it, or should we wait? And if it's, we think it's not an adequate foundation and you should wait. And by the way, additional data are coming that may be more amenable. We should add that.
I mean, you could add that to the end and say that we are aware that additional studies are pending, or
Some of which we know is coming.
Yeah.
Lena?
That just further supports pausing it for now, because by the time that could get geared up to start trying to look at these studies from the standpoint of how you would use them for any kind of a guideline derivation, it would be outdated anyway. So, and not to say that you should use that as a way to keep things on hold, but I mean, I think we've got good solid information saying more information is coming, and let's wait on that. And I agree with John, you do kind of need to look at a broader landscape. And to Dr. DeWitt's point about with current methods, but other approaches have been suggested. So for using NAMs, so I think looking at the larger landscape, and I think we have that capability within a relatively short period of time.
All right. Any other points to make in crafting a addendum to this?
So maybe I'd find a middle ground, to be honest. And that's, so for example, if I knew that these two studies are going to be supported by 2 or 3 more, say in the near future, I would pause deriving a reference dose, but I would encourage the state to begin their critical analysis of the studies, so that when those other studies were available, they could quickly integrate that information and synthesize that information with these 2 studies to make a determination as to move forward with an RFD or a reference dose. I mean, I'm not sure I would say pause everything. It's just there's still additional background that the state could do to just expedite moving forward when those additional studies are available. Just don't derive a value.
Good point. It kind of respects the 2 phases of the question there, right? If the studies were found not to be of quality in the first one, you would say, just wait, as opposed to additional data are coming. Go ahead and fold these into your assessment that you should start building. I hear you.
It seems like we need to say something like that about the Yao study as well, because there's nothing here about the Yao study at all.
Mm-hmm.
I mean, one of the challenges, it sounds like, Jamie, from what you're saying, is that they're going to end up having a variety of different outcomes. So immunotox, hepatotox, and others. And so they may not have, I mean, again, you don't have to divulge what you've got, but I mean, they may have to synthesize across different outcomes, right? And dose ranges. So they may as well start preparing for that.
Since that one was an epidemiological study, I kind of characterized it just in the notes here, not that that's the way that it'll be in the final until y'all have a look at it, was to Jamie's point, the Yao et al. Study's inclusion of lipid panel data is relevant, but then the exploratory nature, lack of experimental design is not your part is not the foundation for how you would evaluate a point of departure under currently used methods that EPA employs.
So you're not editing that on the spot. You're going to come back to us with another draft to take a comment
I think
on?
in the interest of time, since there's another topic to tee up that's
Yeah.
new, and the fact that if we were suggesting that it was time to act on these, then maybe I would try to rush to get that and put it back in their hands. But if the advice that they're hearing from us is that it's appropriate to wait, I think we can wait and get the word crafting offline.
But I guess I'd also caution us not to add the additional information about undercurrent standards. Because again, going back to Jamie's point, which I fully agree with, you could have a single study that's robust enough that you would then derive a value. So I'm not sure there's anything in those guidelines that would preclude these studies from being used had their data been amenable to that approach. I mean, you could take the studies and add all kinds of uncertainty factors and derive a number. That's easy, right? I mean, deriving the number is the easy part. Defending it scientifically, that's the harder part. So I would just be cautious about us coming back and saying undercurrent guidelines precludes the state from actually moving forward.
Other perspectives, things that you want considered in a second draft of this that will circulate for comment. The flavor of which will be a yes to number one. They're both of a quality that could be useful. A no for now to the second one of not adequate information base, but folding in the granularity of this discussion in text that we can share because there's not a pressing timeline for it, if that's the conclusion. Anything else you want to see in there as a draft? Anything else, any other points you want to make for crafting the second draft?
I would just say to continue conversations around the other possible analyses from the traditional approach.
Mm-hmm. So I've got that we would add in near the end when we say, additional data, we say some of which we know is coming. And there'll be not just the NAMS type data, but we're going to hear from Franny, I think right before lunch, an update on the consent order studies as well.
Well, not just additional data, but additional methodologies with the computational toxicology, those different non-traditional ways to do it.
Well, and I would argue that, the timeline is somewhat pressing because there are concerns about the frequency of detection of this compound and the levels of detection of this compound in water. And it is one of those compounds that can break through GAC filters pretty quickly. That's why I think that's one of the reasons it's an indicator compound.
Well, we'll have to expand on that. I'm not saying it's not urgent, but the only action that you can take is derive a reference dose from these studies or not, or wait.
Well, right. So I think Dr. Dorman's suggestion is good that perhaps DEQ should move forward with exploring these studies and seeing what types of reference doses can be derived and how they can be supported scientifically.
I gotcha.
And instead of doing nothing until I get my paper published.
All right. Yeah, that's a good point. So I had from Dave that these two studies, study quality was supported. So go ahead and include them in the database and start doing the background work that you would use in a technical support document for deriving a standard to appropriately characterize these. Great. Anything else to include? We'll tee it up again later and send it around in drafts a little earlier. Thanks for your help on that one. We're moving on to the next topic then. The next topic, I'll have to call up my agenda. is a new topic. We're going to be joined by Chris Ventiloro with Division of Water Resources of the state for PFAS, PFOA bioaccumulation factor evaluation. There's going to be on the last slide a new charge to the Science Advisory Board, which is why it's under the action item portion of the agenda. And Chris is going to tee up the ask for us. Good morning. Welcome.
All right. Good morning. Thank you very much for making time for my item today. Again, my name is Chris Ventiloro, and I am a Water Quality Standards Coordinator with the Division of Water Resources. This morning, we just wanted to kind of provide an update on some of the work that the department has been doing in the development of PFOA and PFOS surface water standards, and to also, as Chair Augsburger mentioned, to pose a request for SAB support and comment on some items. So the work that we've been focusing on so far has been the evaluation of some bioaccumulation factors, or BAFs, that EPA has recently published. And this will help us to calculate surface water standards. This work is really being driven by the publishing of the NCDEQ action strategy for PFAS, which was published in 2022. And part of this action strategy provided some goals for surface waters. And the goals specific to the group that I work with, which is the Classifications and Standards Group, are the establishment of surface water standards to protect water supplies, recreation, and aquatic life uses, as well as to work with the SSAB to determine appropriate BAFs and toxicity values for standards development. So we've begun this work by, as I mentioned, to evaluate some of the literature BAFs published by EPA. And if you haven't seen this action strategy yet, there's a link on the slide that you can reference. But before I get to the BAFs, since we are talking about surface water standards, I did want to just kind of give everyone a quick reminder of what they are. So surface water standards are established by states under the authority of the state rules, as well as the authority of the Federal Clean Water Act. They're established to protect a variety of uses in the surface waters of the state. And the uses that we're mainly focused on with this topic today, with the use of the BAFs, is the human consumption of fish tissue, as well as the protection of surface waters that have been identified as public water supplies. And again, standards are usually established from published EPA criteria documents, referred to as National Recommended Water Quality Criteria, and other published EPA regulatory values that may be used at times, such as existing Safe Drinking Water Act maximum contaminant levels. Now, where we don't have any of these EPA guidance values, we can also calculate numeric standards for toxics under the existing state rules, which can be found in Title 15A of the North Carolina Administrative Code in Part 02B0208. And we generally refer to this as our narrative standard for toxic substances. So, what are bioaccumulation factors and why are they significant for our purposes in surface water standards? So basically, these bioaccumulation factors are there to kind of estimate the accumulation of substances in fish tissue or organism tissues in general from exposure that organism experiences in its natural environment and through the food that it ingests. They're determined by comparing fish tissue concentrations that are taken in the water column in combination with water column concentrations that are taken at the same location. And they're calculated from this fairly simple equation where the BAF equals the concentration of the substance in the fish tissue divided by the concentration of the substance in the water column. And the units of measurement are typically listed as liters per kilogram wet weight. Now, these BAFs are used in standards development to help us calculate these numerical standards to protect for the fish tissue and water supply standards. And they're used to help us really determine water column concentrations that, when met, will prevent the accumulation of that substance in the organism tissue to a level that is potentially harmful to people that are consuming that tissue. And now you can see how we apply these in the rules. Again, these two calculations are taken from the 02B 0208 criteria calculations in the narrative standard for toxic substances, the fish tissue standard, which, really per the Clean Water Act, we protect for the consumption of fish tissue in all surface waters of the state. So you can see how that's done here. It basically involves the use of a reference dose multiplied by a relative source contribution, if available from EPA. And that gets multiplied by the quotient of the body weight divided by the fish consumption rate, multiplied by that BAF. So it's important to note here that in these calculations for our rules, the exposure factors are actually constants that are defined in rule. So they currently are 70 kilograms for body weight, 2 liters per day for water consumption rate, and 17.5 grams per person per day for fish consumption rate. Now we are looking at updating these exposure factors since they are a little bit outdated at this point. EPA hasn't updated them over the years, and that's something that we're looking at as part of this next training review. So what does this look like in practice? This slide is just really to kind of give you an idea of how a changing bioaccumulation factor affects the final calculation of a fish tissue standard. So again, we have the fish tissue standard calculation at the top, assuming the same body weight and fish consumption rates that are found in our rules. And I just selected a reference dose of 0.1 milligram per kilogram per day, just as an example, has no significant relative source contribution of 1, which basically is saying that this is our default relative source contribution. This is basically saying that 100% of the exposure of a chemical would be from the person eating this organism, and then a series of increasing bioaccumulation factors. And you can see how that affects the standard. Basically, as the estimate of the accumulation potential of the substance in fish tissue increases, the standard decreases to provide more protection. We generally get our BAFs from published EPA documents, those EPA criteria that I mentioned earlier. That's our primary source for our rules. If EPA doesn't have published criteria for a specific substance, we'll look to EPA's databases such as Ecotox or even their Comtox chemistry dashboard. And then if we still don't find anything, we'll start looking at other sources such as the scientific literature, work that other states may have done, or even other countries. For PFOA and PFOS, however, we're really fortunate in that EPA recently released some draft aquatic life criteria back in 2022, or well, earlier in 2022, I should say. And as part of these aquatic life criteria, which are usually, they're focused on the protection of aquatic life, but what's interesting about these criteria is that EPA has also moved to provide criteria not only for water column values to protect aquatic life, but also for fish tissue values to protect aquatic life. So in the process of doing that, they've very much done us a favor by kind of coalescing all of the available scientific BAF, the scientific literature BAFs for PFOA and PFOS, and doing an evaluation of them. So that has saved us a lot of work. That's something that, we have limited staff. So this really kind of saves us a lot of time, at least for these two PFAS. Just to give you a real quick summary of some of that evaluation that they did. EPA did find literature BAFs that were sourced from areas across the world. North America, China, and Europe were some of the main studies that had been looked at. In North America, we had a reservoir, Lake Neopenco, in Ontario, Canada. In China, there were a number of different sites that were looked at. And in Europe, there were two tidal areas, one in a lagoon in Italy and an estuary in France. And one thing I did want to mention here is that staff did make an attempt to try and determine if we could identify what the potential PFAS sources were for each of these areas. And that was very difficult. We didn't find much information. We did see that Lake Neopenco seemed to be associated with an old firefighting training facility that obviously associated with some firefighting foams. that was potentially still kind of an ongoing issue there. And there was one location in China, I believe it was Taihu Lake, where now most of these sites in China, from what we could determine, were associated with various land use types. They all seem to have at least some influence from kind of urban and industrial development areas. Taihu Lake in particular had some industrial areas, and just kind of looking at Google Maps, Franny was able to actually figure out that there was a 3M facility located not too far off there. So that's kind of, we did kind of attempt to figure out if we could see some PFAS sources, but that's kind of the best that we could do for now. I believe that there's some other work going on outside of the agency, I believe, that's looking into kind of putting this type of information together more broadly for PFAS in general. So EPA took all of the scientific literature-based BAS that they had, and they basically kind of evaluated it as you see on the slide here. They looked at the number of water samples collected at each site, the number of organism samples. They considered the temporal coordination, so whether those samples were taken together at the same time or whether they were taken at different times. They also considered spatial coordination. Were they taken at the same location, like the same exact site, or were they taken at different areas within that site? And then lastly, of course, they looked at general experimental design. So of the studies that they looked at, they split them up into high, medium, and low quality. And you can kind of see for high quality were samples that had more than 3 water samples, more than 3 organism samples, and that those samples were taken concurrently. And that's really ideal for the BAF studies, is that you're really trying to show what's, you're really trying to draw a direct comparison. What's that water column concentration versus the concentration in organism tissue to give you a good snapshot in time of, what you expect the accumulation rate to be. Now, when EPA eventually put together their list of BAFs, they excluded all of the low quality studies. So they were just left with the high quality and medium quality. So what NCDQ staff have done with this information is that we took their final list of BAFs and we kind of parsed it down further to focus on fish species that are known to be resident species in North Carolina. Now that they don't have to be, native species, but they do have to be, we consider species that had some resident populations here, such as common carp, which is found actually throughout the state. We also wanted to consider shellfish because North Carolina has an active shellfish industry, and there's potential for those organisms to be commercially distributed throughout the state. Now, from the literature BAFs that were provided, there were none that were the equivalent of the resident species that we have in North Carolina. So what we did instead was look at kind of analogs. And we basically determined that based on the taxonomic similarities. So, if organisms shared the same genus or family, we basically considered them with the species that's natively found or resident in North Carolina, we considered them as candidates. So an example of that would be that, the Pacific oyster was looked at in some of these areas. So they're taxonomically similar to or related to the eastern oysters. So we use that information. The other thing we wanted to do was focus really on the more commonly consumed species that had literature BAFs. So a lot of, keeping in mind that when EPA was doing this evaluation, they were focused on developing criteria to protect aquatic life. They were very interested in all of the BAFs they could find from all the different species. So that resulted in a lot of BAFs from species that wouldn't necessarily be consumed, like little minnows or like little mudfish and things like that. Or for invertebrates, they actually included BAFs from zooplankton and worms. So we really kind of parsed out the species that we felt were more commonly consumed, and we were focused more on like game species and obviously the shellfish, which are the oysters, mussels, and clams that we had available. Again, in keeping with that same train of thought, we wanted to focus on the more commonly consumed portions of those organisms. So for fish, we focused more on the muscle tissue BAFs. And for shellfish, we focused obviously on the whole body because people tend to consume the whole body of the shellfish. So what did that leave us with? So from the list of literature BAFs, that EPA had that left us with about 24 BAFs for PFOA and 23 from PFOS. And we put this slide together to give you an idea of what types of tissue, like how many of those BAFs came from what type of tissue, and also from where they were sourced from the studies. So for example, for PFOA, 9 of the BAFs were from fish muscle tissues, and all 9 of those were sourced from the study that was done in Canada. Likewise, there were 2 fish muscle BAFs. They were both from the same species, the common carp, and that was sourced from the China studies. Similarly with the shellfish, we had about 13 BAFs from whole body shellfish, and 2 of them were from China, 1 of them was from France, and we had about 10 from Italy. And you can see the species breakdown next to that. There was 1 species that was looked at in China, 1 species in France, and 2 species from Italy. And similar to the PFAS information there, you know, the fish tissue or the fish muscle tissue BAFs and locations were very similar. Most of the fish came from Canada, et cetera, et cetera. And then that brings us to what we actually saw with the BAFs when we looked at them. So basically what we came up, this is for PFOA, for the BAFs that we kind of parsed down. For the fish tissue, or the fish muscle tissue, we ended up with a range of 2.884 to 213, and a geomean of 12.559. Now, we didn't round any of these data. This is just strictly from what we got directly from the papers. So you're going to see different, decimal places and such. And then an average of 29.029 and a median of 10. Likewise, for the shellfish whole body, the range extended from 11.86 to 9,680. Geomean 169 generally. Average was about 1,340, and the median was about 128. And then we looked at them both combined. If we took both the fish tissue or the fish muscle tissue and whole body shellfish and combined them together, we ended up with the geometric mean of those North Carolina resident species of about 51, an average of about 740, and a median of about 32. For PFOS, same type of information here. We looked at the fish muscle tissue and shellfish whole body separately, and then both combined. So you can see the ranges are a bit higher. Generally, it seemed the bioaccumulation factors for PFOS were generally higher. Geomeans, obviously, 1,962, 1,356, and 1,644 for the geomeans for all of those. And then that kind of brings us to our request for the SSAB, which, we're really looking for feedback on the process that we used and kind of how to move forward. So the first request that we have is, does the SAB support the use of EPA literature for the Foundation for BAFs in North Carolina? Is the method that we've applied to the EPA vetted BAF data scientifically sound approach for North Carolina BAFs? And then lastly, which value of the BAF is most appropriate to use? Is the average, the geomean, the median, or maybe some other statistic? And then, of course, is there other information that the board would like to see moving forward that would help to evaluate this? So
Thank you, Chris.
I have for now. Thank you.
Don't go away.
I won't.
I'm going to propose, so we're not going to decide all of those questions today. We're going to revisit it between now and the December meeting. But I do want you to leave today with clarity on the questions, that they're crystal clear, you know exactly what's being asked. It's X and not Y. And then also, is there anything else you would need besides the homework that the state has done and the references for where they found the data to be able to answer the questions? And we should ask Chris questions to get at those 2 topics, not necessarily to answer these questions, but to make sure you're clear on the questions. And would you need anything else to be able to answer them. And I'm going to start, and then I'm going to go to Dave. Could you go like to the second slide, and maybe I have it wrong, where you, I think it was like the data preference. Maybe go, no, go back. I think it was that one.
This one here.
So standards are established from whether EPA has a water quality criteria or another value, or you'll have to calculate it yourself. And I get that the bioaccumulation factor that you're after would be critically important for compounds like PFAS that bioaccumulate to protect humans that eat fish, as well as fish themselves. And so I get it that for like the stage 3 there, if you had to derive your own values, you'd have to have a BAF. But I guess what I missed was if EPA has draft recommendations for protective values, why wouldn't you just use those? Is that because those are only going to be for aquatic life and not human health? I was just trying to reconcile, not scientifically why you needed a BAF, but why can't you just adopt EPA's criteria and be done?
Yes, good question. Thank you. So yeah, the criteria that EPA has released so far, they're draft criteria, so they haven't been finalized yet, but they are specifically designed to be protective of aquatic life. So you're going to likely see values that are going to be higher than what would be necessary for the protection of human health for people consuming this fish. I believe the fish muscle tissue criteria that they proposed was about 1.1 milligrams per gram of tissue. But again, we're looking at, for what we call our human health standards and surface water standards world, is the fish consumption standard, which is a water column concentration that will help prevent that substance from getting so high in the water column that it will actually accumulate to harmful levels in the fish. So it's kind of a different measure. Now, EPA, I believe they are working on developing criteria recommendations for fish tissue consumption and water supply, but we don't know at this point when they're going to come out. So part of this work is to really kind of take, a more proactive approach to say, okay, well, let's see what information we can come up with ourselves. And, if during that time EPA publishes some criteria, we can certainly go that route instead. So I hope that made sense and answered the question.
It does, thanks.
Okay.
So I see the bottom of the slide saying that if EPA had a water quality criteria that derived a number that was protective of ecological health and human health, you'd probably be asking us to adopt that.
Right.
If they had what you say they're working on, the second tier of a value for contaminants in fish that's translated to then what's safe in water, that could potentially be used, but that's not available yet, something that's being worked on.
Right.
So you're at step 3, which is the state has in their rules the ability to go ahead and derive their own number for surface water that would be protective of consuming fish. And that's what you're after.
Correct.
Thanks so much. I'm going to open it up. Then if you could flip to your last slide, just so people know what the questions are. And you all are welcome to ask Chris anything. Dave.
So if you could go back a slide or two, it doesn't, So I guess it's not clear to me if this is a truncated data set that met all the other criteria. So for example, like you've got fish muscle, those 13 studies or whatever the number is, are based upon on whether or not they actually represent like a resident fish species, as opposed to a larger data set. And I guess maybe the question, like I'm not a fish expert, but I would start to wonder, to what extent does that actually matter, that it has to be a resident fish versus, say, different classes of fish with respect to being predators, non-predators, that type of thing. So I wonder if that truncating inclusion-exclusion criteria you're using is maybe not giving you as good an estimate of what an average fish might look like.
Yeah, that's a good point. And I mean, and that's really one of the things that we're hoping maybe the SAP can weigh in on. I mean, we typically, when we're thinking about the fish tissue standard, we're in our minds, we're thinking about, well, what are people eating? What parts of the fish are people eating? And that really helps us to focus on the kind of more directly on the exposure without veering into the, veering kind of off track to say, well, yeah, this fish may really accumulate it for some reason based on what they eat or something about their biology, but if
Right.
nobody's eating it, are we giving too much, are we putting too much emphasis on that information? So that's kind of the general way we think about it when we're thinking about the tissue consumption.
Okay. But then I guess a related question, if you show either one of your summary tables that show the actual ranges,
Yep.
you've got, like, so for example, for PFOA, you've got almost 100-fold difference with respect to fish muscle range.
Mhm.
So based on what you've just said, the 2.884 as well as the 213 could be relevant to fish consumed here in North Carolina.
They could be. And one of the things that I tend to focus on when I look at these is the geomean, because it's important to take into consider that we're looking at these studies that have been taken from all over the world in all different types of ecosystems, all different exposure scenarios. BAFs can be very site specific,
Sure.
right? So what we're trying to do is kind of, I guess our efforts in summary are really trying to kind of focus on the information that we know is relevant to North Carolina specifically. Now, there's certainly an argument to use everything. But what that does is that, so for example, I could tell you that 9,680, that was, very much an outlier. That was from that one
was my
study.
next point is,
Right.
so like does your means and averages actually exclude outliers either statistically or you've got a biological plausibility for outliers?
And that tends to be my focus on the geomean, to at least that kind of, that gets to that central tendency. But, we're also open to other kind of measures, like percentiles and stuff like that.
So I have one other question and I'll shut up. But
Very good.
the other question is, can you ground truth your value from experimental studies conducted in bass, other species of fish, including zebrafish, in which in vivo studies may have exposed animals where you don't have the loss of temporal association, you've got more controlled experimental conditions where you can ground truth whether or not a mean or an average or a median value may be more consistent with what might be available in the aquatic tox literature where fish have been deliberately exposed and tissue concentrations measured, if that data even exists.
Yeah, and I think that's a great idea. And I think that would be the challenge, is seeing if that data exists. But that's a good comment. Thank you.
Yeah.
Yeah.
A lot wrapped up in there. North Carolina has over 200 species of native fish and a couple dozen species of introduced fish, some of which are consumed. So the perfect answer might not be available. So at some point, culling data, ought to be informed by a wide decision. Other questions to understand the question that's sort of being posed, Jamie?
I have a really, really simple question with respect to question number 1.
Sure.
EPA literature is pretty broad. Do you want to give us some specific literature back to what you referred to at the beginning of your slides? So those specific aquatic life criteria is what you mean by EPA literature from which you got these data?
Yes. Yeah. So the EPA literature the EPA criteria documents that EPA has put out so far are these draft criteria. And in this, they evaluate from literature from a number of different studies. I don't remember the exact studies off the top of my head. I know there's one Burkholder study that really, the evaluation, I think that was published in 2021 or 2022, that the evaluation was really kind of taken from, I believe.
Yeah, I just wanted to make sure that you want, it's these 2 documents as opposed to some other EPA literature
Right,
that
yes.
we might find, or you might find, or anybody might find.
Yeah, we were specifically focused on these 2 documents because they provided a summary of that evaluation. So, yeah, thank you.
It's a good clarifying one. Thank you. Other questions for Chris to clarify questions or in general? Rich?
So do I understand you that you did exclude some fish species because you didn't think they were relevant to?
Yeah.
Like, I guess I'm leery of that. I mean, there's so much, like Tom mentioned, there's hundreds of species here. And how would you know if you didn't have data for it, if this or that species was representative of, say, something that people eat a lot of, like redfish, speckled trout, flounder, and so forth, which I'm guessing there's very limited data on some of those species. So I'd be kind of leery of limiting a species. I totally agree, going out outliers is a word, but limiting a species because you didn't think taxonomically it was close enough to what people eat in North Carolina.
Yeah, and that's a good point. And that's where, some of the struggle is with, what do you exclude? The fish that we focused on were species that we know are consumed, like game species, like largemouth bass, smallmouth bass, crappie, bullet trout, common carp, things of that nature, as well as the invertebrates. The things that we excluded tend to be things that were more like little minnows. That were more like little minnows or, like little, kind of tiny little bait fish type of things. Yeah, so we didn't, and fish that maybe didn't really have at least that we could determine, which, we used, our water sciences section has a really great and useful spreadsheet on their webpage that basically documents all of the kind of indigenous and non-indigenous species that they've kind of identified over the years throughout North Carolina in different water bodies. And it kind of gives you an idea based on river basin where they've been found. So kind of using that list in conjunction with DHHS, North Carolina Department of Health and Human Services, fish consumption warnings, and also with Wildlife Resource Commission's kind of game species profiles and things of that nature, using those resources to try and figure out, okay, these are species that are likely going to be consumed. They're here in North Carolina. They're likely to be consumed versus something like a minnow, which maybe people eat them, I don't know. But yeah.
So, do you feel like you captured, all the ones you mentioned are kind of typical freshwater game fish. Did you capture estuarine species, which I'm assuming I personally eat a lot more of than bass? And I think a lot of people do. And if you go to the seafood market in Morehead City or whatever, those are all locally caught fish that people are eating a lot of.
Yeah, and unfortunately, there wasn't really much in the way of estuarine species for fish, BAFs. Most of the BAFs we ended up taking were from that Canada study, which was in a freshwater reservoir. The things that we did have from the estuaries were their shellfish. So there might be some comfort, I believe, in that the shellfish tended to accumulate things a bit more than the fish muscle tissue. So factoring those in, to the overall evaluation kind of might help, skew it in that direction. But yeah, we didn't really, as I recall, didn't have we didn't have striped bass. We didn't have sea bass or flounder or anything like that in the BAF data set.
For this,
Might be leery of excluding species. I get the little bait fish and stuff, but.
Yeah.
is there, for the things that we might need, is there a support document or a database where we could look at and see, in addition to what the state did, how you did it, so that you can see, what was ended up with and what was excluded?
Yeah, we do have, I guess we didn't put anything, Franny, we didn't put the documents up like the spreadsheet. Okay. So yeah, I don't know if you heard Franny, but that we do have a spreadsheet that kind of shows the process a bit and also a little write-up that should be provided in the support information to you all.
Great. So go flip up to your last slide just so that people can focus in on, the making sure we're clear on questions, and you can continue to ask Chris anything. John, and then.
It may relate to the last point you made. Is there a document or documents for us to review for number 2? Because we've heard the method, but it'd be good for us to review what we actually did.
I think that should be covered in the supporting document information. And if if there's more information than what you see in that you would like, just, let me know and we can flesh that out more. We just kind of did a general summary, but if there's more, just let us know.
Jamie?
I would just echo Dr. DiGiulio that if there are additional data for brackish water fish and saltwater fish, we include those because those are going to be heavily consumed in some areas that do receive downstream exposure from the freshwater point source.
Sources. Yeah, and we can go back and relook at that also to make sure we didn't unintentionally leave that out.
That's you or Elena. You have any questions clear enough to you or any clarifying questions before we move on?
The questions themselves are clear enough for me at this point. I did have, if you could just refresh my memory on, these are derived for the water quality criteria. They're derived for a generic individual as opposed to high-risk groups. Okay.
Yes. Yeah, and you could see that in the exposure factors that we have in the world. Generally, it's for adult, kind of an average adult person. I think the body weight, I believe, is taken from the NHANES data, and it was the average body weight, I believe, and the water consumption might have been like the 90th percentile, and something similar for the fish consumption rate.
Because I seem to remember, and I'm just trying to put this all in a framework, mental framework for myself. I seem to remember that they do, now I'm jumping to fish consumption advisories, but how does that work? How is that related to this?
Right.
Because I seem to remember for pregnant women, there was something, or children, there was something somewhat different.
Yeah, so I kind of look at our surface water fish tissue standard as kind of being the flip side maybe of the DHHS fish consumption advisories, right? Because with the fish consumption advisories, they're going out, collecting fish, looking to see what the concentration is in the tissue and then doing a risk assessment.
All right, thank you.
To come up with how many fish are safe to eat. We're trying to look at it from the opposite perspective, where we're trying to prevent the concentration in the water from being high enough to accumulate to a harmful level. So it's kind of a balancing thing, I guess.
Thanks, that refreshes my memory on it.
And yeah.
Two things that might help me would be, knowing, and it's probably in the EPA criteria document, but when was it that they stopped collecting data? So we've been asked, is that going to be an adequate foundation? I'm sure we'll see it in there, but we could speed up that process by saying, at some point they would have had to cut off. We're not going to add anymore because we've got to make sense of it at some point. And then the second thing would be is if there's any discussion there, or if others know, or we could dig into it a little bit, is there anything that helps explain the range of BAFs in aquatic life? Has that been the subject of some study? Or like, metals availability, people have all kinds of parameters like hardness and carbon that help explain availability data. Is there anything here that helps explain it such that you might be able to use a science guided way to put things out of the database instead of keep it in, other than just taxonomic similarity? So if there's something that helps us understand some attribute of water chemistry or some aspect of fish physiology besides just duration of exposure, I think that'd be helpful. And if there's not, it would still be helpful, right, to say that we don't have a reason for keeping it in or out. Any last questions before we say that we understand the charge? Because again, this is going to be revisited. I just want to make sure that we're off on the right foot while we have the State Water Standards Coordinator in front of us. All right, well, thank you. We will provide you all with some of this background information and we'll revisit this topic, but thanks for teeing it up for us.
All right, thank you so much. I really appreciate your time.
Sorry, can I just before you?
Yeah, absolutely.
If you go back to your second slide, as far as the narrative approach,
This guy here?
maybe earlier, that one.
This one, okay.
What you call the narrative standard for
Yeah.
toxic substances. Does that not provide guidance as to which value one would use, the mean versus geometric mean? So
No, it does not in that sense, because basically the language says that we'll take BAFs published using EPA guidelines. And that's pretty much it. And EPA, I mean, I think as far as I know, it's typically geometric means, but I don't know if that's universal.
So I mean, it may be, if that document, which is the guiding document, points to an EPA guideline that specifies, say, a geometric mean, then that seems like that becomes a null question for us to ask. That's part of why I was asking
Okay.
is there actually any guidance that the state would need to follow?
Okay. Yeah, I'll check into that. I don't think they specifically list that out, but I'll double check just to make sure.
Thank you, Chris.
Okay, thank you.
All right, we only have a few minutes before we break for lunch, but I'm just going to ask Franny a procedural question. The next two topics, and we have finished the business items on the agenda, thank you. Took a little bit longer, but I wanted to make sure we had clarity on the business portions. For these informational items, are either of them 5-minute updates? Because if they're not, I'm going to suggest that we just move them after Dr. Hoppin's presentation. Since we only have one public comment, we know we won't run long, I don't think.
They're both relatively quick. I think that given the discussion we just had, the fish update might be most appropriate to give for lunch.
But is it a 5-minute one or is it a 15-minute one? Because if it's a 15-minute one, we can just catch up with it later.
Yeah, I think if anyone has questions, it'll be more than 5 minutes. So
Yeah.
maybe we should do it after lunch.
And is the other one a little bit longer or shorter?
I'm same. If there are questions, it'll be more than 5 minutes.
Yeah. So how about, I'll ask the board, is it okay with you all if we do Dr. Hoppin's presentation after lunch, since that's got a set time? And then we'll get these two updates without being rushed. And I still think we'll end well on time because there hasn't been, there's not a lot of, there's one person who signed up for the public comment section. Is that okay with folks?
I remain.
All right, let's reconvene then at, why don't we reconvene just a little bit before 1 so that we can be sure we're online and ready for Dr. Hoppin's presentation. Thank you all. Let's reconvene then about 12:55.
But you were officially in the narrative. No, you're not later just until we're out. That's an extreme, like, probably starting to get to I can hold it out. Or something.
Dr. Jane Hoppin with the Gen X study presentation and other topics. And then we're going to revisit the topics that we skipped just before lunch, where Dr. Franny Nelson's going to update the board on the consent order toxicity studies and their summer 22 data collection for Pfas in North Carolina fishes. So that'll be the order this afternoon, and then we'll close out with the public forum. Thanks everybody for attending again, and it's my pleasure to introduce Dr. Jane Hoppin as the next speaker. She's an associate professor of biological sciences at NC State University, and among other accolades was the 2021 winner of the Governor Holzhauer Jr. Award for Excellence in Public Service. Thanks for being here today. I look forward to your presentation.
Thanks. Well, thanks for having me. And I can take questions as we go or at the end. I have never spoken about the Gen X study to this panel, so I thought I would start with kind of an overview of the study and then a little bit about some recent findings. So today I'm going to talk about how the Gen X study started and what do we find. And then talk about the National Academies recommendations for PFAS monitoring and testing. I was on that panel and it was a lot of work to try and sort through what to recommend. And so how does what we're seeing in North Carolina compare to those recommendations? And then where are we going? We're moving toward a health study, and hopefully in the next few weeks, we're sharing our PFAS results next round with our participants. So we started the Gen X study in November of 2017, really designed to answer community questions about Gen X and other PFAS exposure. And so what do people want to know? They want to know, is Gen X detectable in my body? What predicts Gen X in my body? And are there health effects associated with Gen X? And Gen X has become the key word, though, now everybody in that region often uses Gen X as the catch-all for PFAS. So we started in November 2017 in Wilmington, and then again in Fayetteville in February of 2019. And we were initially funded by NIHS through their time-sensitive grants program. We also received matching funds from the NC Policy Collaboratory. So what did we do? So our study design, I'm going to talk about Wilmington today. We enrolled Wilmington residents who are in Cape Fear Public Utility Authority water. And so as you probably all know, the Cape Fear Public Utility Authority collects water, provides water primarily from the Cape Fear River, but they also have a subset of people served by groundwater. And so and they don't blend it. So we were able to look at differences in exposure in that, though we didn't we just enrolled anybody on the Public Utility Authority. We had 344 people enrolled, and we collected blood and drinking water that we analyzed for Gen X and other PFAS. And then we also analyzed blood samples for thyroid hormones, lipids, and a comprehensive metabolic panel. And then we collected questionnaire information on residential history and medical conditions, and we've reported back results. So we had 344 people participate, 289 adults and 55 children, ages 6 to 17. It's racially diverse. We had about 24% non-white participants. And so it's hard to build trust in a short period of time. So I think we did relatively well recruiting a diverse sample. One of the things, and you can see on this chart, is we also had a lot of variability in how long people had lived in Wilmington. So the red bar are adults and the blue bar are children. And you can see that about 45% of our adults had lived there more than 20 years, but about 10% had lived there between 1 and 5 years. And so this gradient allows us to really potentially look at differences in exposure just by duration of time in Wilmington. You can also see a similar gradient for children. So just to cut to the chase, our blood results, we analyzed for a full suite of both fluoroethers and legacy PFAS. We had about 24 of them, and we detected 7 PFAS in the blood of almost everyone. We had 3 brand new PFAS that we measured in almost everyone: Naphthalene biproduct 2, PFO4DA, and PFO5DOA. We did not detect Gen X in anyone. A couple summers ago, we learned why, because the half-life of Gen X is 3 days. So since people had stopped drinking the water in July of 2017, we wouldn't expect to be able to detect that, and we did not, but that's still an important exposure that we haven't characterized through blood. And then we measured 4 legacy PFAS in the blood of everyone: PFOA, PFOS, PFNA, PFHXS. We also measured PFO3OA and Dhhs and hydroeve detected in a subset. And this work was published by Nadine Kotlars in June of 2020. I'm sure you're all familiar with these very long, complicated fluoroethers that are byproducts of production. So we're more likely to see the high molecular weight chemicals in people's blood. So the levels that we found of naphthalene biproduct 2 and PFO4DA were pretty much comparable to the levels of PFOA that we measured in this population. And so just to remind you, if you don't look at box plots all day long, the middle blue line is the median, the top of the box is the 75th percentile, the bottom is the 25th, and the tails are the 5th and 95th percentile. So there's a wide range of exposure to these chemicals in this population, and that may be due to that diversity of duration of time in Wilmington. So for the legacy PFAS, we can actually compare these values to other chemicals. And so here's the data for Wilmington in 2017, and we're doing 2 comparisons here. First is the first year that NHANES measured PFOA in blood. So as part of the National Health and Nutrition Examination Survey. And so what you see in the white box, the first white box, is that the US population in 1999 looks a lot like Wilmington in 2017. And granted that we have a much smaller sample size, but we also have children and they didn't have children. So we see the higher levels that look like almost 20 years before we were sampling. And then at this point in time, we had data from 2015, and what you can see is that the median level in Wilmington exceeded the 95th percentile for the US population in 2015. So arguing that Wilmington residents are highly exposed to PFOA. And if you make this comparison across the board, and here I have Wilmington is in green, Fayetteville is in khaki, and NHANES are in white. And so that you can see that the green and khaki bars are always elevated compared to the US population. And so we see this with PFHXS, PFOA, PFNA, and PFOS. So elevated levels. And also we see Heather Stapleton's group sees similar elevated legacy PFAS in Pittsburgh, which should not have been impacted by the Fayetteville works.
Do you want to take questions as you go along?
Yeah, sorry, I'm like,
Where's that voice going? Could you go back one slide, please? So it's pretty striking that the white bars there, the US NHANES from 99 to 2015 went down so much. Any reason why?
Yeah, so there was a gentleman's agreement to stop making products with PFOA and PFOS in the United States with EPA consent decree. And so they did stop manufacturing chemicals using PFOA and PFOS in products in the US. And so we see that whole level coming down. And so what this also begs the question is, what did Wilmington look like 20 years earlier? And if we were to back calculate, we probably wouldn't get levels as high as the C8 study, but we get pretty high, so right now, we only have one point in time to work from. So
the NHANES won't give you the data back from the samples from Wilmington, the area back?
No, so the NHANES, while it's nationally representative, it's not really geographically representative. And so, they're there's very little kind of national sampling. And probably what would be more helpful to us is to see if we can find samples that have been in the freezer. And so one of the things that we have found samples from Wilmington that were in the freezer from the mid 2000s. And so we have about 120 of those that we're going to analyze probably in the next couple months. And this will give us a vision of what was in people's blood before they knew that their water was contaminated. So will we see Gen X in people's blood at that time? Will we, what were the levels of naphthalene byproduct 2 and PFO5 and PFO4 DA? So we'll have a much better picture. But what we don't know is right now, blood samples tell us a lot about today, but can't tell us about the past. And one of the things we also don't know, and we would assume, is that it's probably not all there's still some continuing exposure. So we can't just assume first order kinetics from some point in time. So yeah, we don't know what the peak exposure was. But I think it's worth trying to understand.
Thank you.
So this is, Nadine is working on a paper now where we're going to describe our blood sampling efforts in Fayetteville and our water sampling efforts. But I wanted to put this all in context as it's not just a Wilmington problem. So thinking about how much of the fluoroethers contribute to the overall PFAS burden. And we also detected another fluoroether named Hydro-Eve, but at that point we didn't have analytic standard. And we actually now are revisiting about 80 samples from our original sampling and looking and seeing how we can quantify Hydro-Eve. So one of the things to remember is summing all PFAS will miss the total PFAS because we know that there's PFAS that weren't in our spectrum. So here's the overall of what was measured in blood. We added up all the 20 PFAS that we had to text for. And so you can see that about over 20, this is the median blood concentration. So there's lots of higher concentrations. So about over 25 for adults and about 17 for children. And then when we look at the contribution of the fluoroethers, in adults it's 23% and in children it's 26%. So when we add up our PFAS, if we just look at the legacy PFAS, it's probably a big underestimation. And we didn't see chemicals like PFMOAA and some of the other lower molecular weight ones. So this is just to put in context, what do we miss when we use blood as a marker of exposure? So this is a little complicated slide, but so this is, the bars are the levels of PFAS in the Cape Fear River water collected at Lock and Dam 1 in 2015. And this is work by Dhhs student Shui Zhang. And so what she did was reanalyze some water samples. And so the first thing to notice is that it's on a log scale. So the levels of PFHXS are a little over 10. The levels of PFMOAA exceed 100,000 nanograms per mil. And so the bars in red are chemicals that we detected in blood. And the bars in blue are chemicals that we didn't find in blood. And we had analytic standards for these chemicals. So we know that people were drinking that water, but blood is a bad marker to pick up long-term exposure. And I have PFMOA in shaded lighter color of blue because because we've optimized our blood samples for the higher molecular weight, it elutes very early and it's hard to resolve in this spectrum. So maybe PFMOAA we could detect in blood if we weren't trying to look at all these other things. So that's a very quick link at what we have detected in people in Wilmington. And then I want to move on to just make you aware of the National Academies report focusing on guidance for PFAS exposure testing and clinical follow-up that was published in July of 2022. And so we deliberated, our charge was to focus only on the human health literature. And so in evaluating the human health literature, we found sufficient evidence of an association with PFAS. And we also considered any PFAS because in some studies there's higher levels of PFOA and some PFOS. And so rather than trying to create chemical specific guidelines, we just used any PFAS. And so these may be more relevant to some PFAS than others, but that was a choice we had to make. So decreased antibody response in both adults and children, dyslipidemia in both adults and children, decreased infant and fetal growth, and an increased risk of kidney cancer in adults. And then the limited suggestive evidence include increased risk of breast cancer in adults, increased risk of testicular cancer, liver enzyme alterations in adults and children, increased risk of pregnancy-induced hypertension, thyroid disease and dysfunction, and increase of ulcerative colitis. And so there's a lot more things that have been looked at, but the data hadn't really, there wasn't enough data to really agree on that. And one of the recommendations we also made is that this literature review should be updated every 2 years, and the clinical guidance should be updated every 5, if not sooner. And so what we recommended is we created 3 very broad categories of total PFAS. So for PFAS levels less than 2 nanograms per mil, adverse health effects of PFAS exposure are not expected. And then this broad category of 2 to 20 nanograms per mil PFAS, potential for adverse health effects, especially for sensitive population. And then above 20, an increased risk of adverse health effects. And so a lot of these were based on estimates that came out of the German human biomonitoring program, and we recognize that things are very broad here. And the sum of the PFAS are ME-FOSA, PFHXS, PFOA, PFDA, PFUNDA, and PFOS and PFNA, but they're driven by the 4 most common ones. In NHANES population, we would assume about 8% of the people are less than 2, and about 8% of the people are over 20. So the recommendations for the follow-up is that standard of care for less than 20, 2 to 20 is usual care, but focusing on screening for dyslipidemia, hypertensive disorders of pregnancy, breast cancer screening. So even though things like altered antibody response, there's nothing really to advocate for. For people who with PFAS above 20 nanograms per ml, but in all situations, reduced exposure is recommended. But we also want to prioritize dyslipidemia screening in patients over 2. So that's different. So, and then at all well visits to test for TSH, thyroid function testing in everybody over 18, assess the signs and symptoms of kidney cancer, and for patients over 15, assess the signs and symptoms of testicular cancer and ulcerative colitis. And so a lot of them, there aren't good screening tests, but to make people aware. So these are based on just the legacy PFAS, not the rest of the chemicals that people have been exposed to. And so if we look at the Gen X study, over half the adults exceed the 20 nanograms per ml recommendation. So over half the people in Wilmington exceed the highest threshold value. The median value for some PFAS was over 20. For most of the children in the cohort, about 90% were within the 2 to 20 range, and about 10% were in the above 20. And the median value for some PFAS in children was 11. And about half the adults were in the 2 to 20, and no one was in the less than 2. So clearly people in Wilmington are at highest risk of some kind of PFAS impact. And so to close, I'm going to start in what we're moving now toward a health study. And so first of all, we're analyzing the data that we have in hand. And so Emma Rosen, who is a doctoral student at UNC, conducted an analysis where we looked at cholesterol levels. And we measured in the blood of our Wilmington participants, we measured, we had non-fasting samples, but we measured total HDL, LDL cholesterol, and triglycerides. And then we also calculated out non-HDL cholesterol to account for variability based on fasting status. It seems to be less variable with regard to fasting status. We used something called inverse probability of treatment weighting to adjust for confounding. And we assessed effect modification by participant age. And so what we saw was that legacy PFAS, particularly PFOA and PFNA, were associated with higher levels of non-HDL cholesterol, total cholesterol, and LDL cholesterol. And while this isn't groundbreaking, it's reassuring that we see what's been seen in other PFAS studies. But given the small sample size, it's still kind of a signal that there's a lot going on. And with Nafion byproduct 2 and PFO5 DOA, we saw associations with higher levels of HDL cholesterol, but other fluoroethers were not associated with HDL, and they were not associated with non-HDL cholesterol. So all of these argue perturbations in the lipid system and given our small sample size, it's challenging to mutually adjust these things. And yes,
Can I ask a quick question?
sure.
So how did you control for lipid lowering drug use, especially among the older population?
So we asked about people who were taking lipid medication. So anybody who said that they had been diagnosed with high cholesterol, they were asked whether they were on lipid lowering medications, which is similar. We used the same protocol that was used in the C8 study. And we didn't see, like it didn't make a huge difference, but the levels of increase are very small. There's like with each quartile increase in PFOS, it's about a 6 nanogram per milligram per deciliter increase in cholesterol, whereas a cholesterol lowering medication can pretty much cut your cholesterol levels in half. So again, we're kind of limited because we can't like call out the people on cholesterol lowering medications. And also we saw that there were the results were stronger in the oldest people. So we would expect the oldest people to have the highest levels of PFAS, but even in them we see exposure response relationship. So this was just published the end of August, and I'm happy to send you the link to that. So where are we going with the Gen X study? So we are part of the NC State Superfund Center, and we have a project that's focusing on thyroid disease. And so we're transitioning from an exposure study to a health study. So we've grown from 500 participants to over 1,000 participants throughout the basin. So we have the Lower Cape Fear area, both New Hanover and Brunswick County. We have the Fayetteville area and Pittsburgh. And the Fayetteville area is defined based on whose well has already been tested by DEQ or chemours. And so we've been sampling from that list. And so it includes participants who live in not only Bladen and Cumberland County, but also Robeson. We don't have anybody yet from Sampson in our Sampson County. So we have a 5-year study. We got funded in February of 2020, so things have been slow. We had 2 blood collect. We will have 2 blood collection events. We collected blood between November 2020 and November 2021, and we are just about ready to share those PFAS results with our study participants and have public meetings to look at that. And so I'm happy to come share that with you at a later date. We're measuring thyroid hormones, TSH, free T4 and T4, and we got some additional funding to look at response to COVID vaccination. So the concern with antibody response to vaccines is that most vaccines are super effective. And so where it might be most important are for vaccines that are not as effective. So we will have some data on antibody response, which still may not relate to efficacy, but we have some data on that we are starting to analyze now. So our next steps, we are getting ready to report the results from almost over 40 PFAS in the blood of 1,000 people. And we're having a webinar for everybody in October. So hopefully, if the IRB gods align, we will have a public webinar on October 17th and then community meetings after that date. And so there's lots of people, and they're not on here, but it's definitely a team sport to work on this project. And I'm happy to answer any questions.
Thank you, Dr. Hoppen. We appreciate your review of the Gen X study, past, present, and future, and also the work and synthesis of the National Academy of Sciences recommendations. I'll open it to the board for questions. We have probably about 10 or 15 minutes for questions.
I have one question just for clarification. If you can go back to the clinical guidance, that pretty slide.
Yeah.
That one. So in the 2 to 20, so it is not advocating for it's still the standard of care. It's just that if you can't do all of the standard of care, make sure you at least get these done. And then in the red, there's no, and I'm just specifically thinking about breast cancer screening, there's no place of enhanced breast cancer screening. It's just make sure you do these standards of care.
So, right, so the more than 20 is 2 to 20 plus 20. So lots of so part of it is encouraging people, like prenatal care will help follow, preeclampsia, low birth weight. And so there was nothing more to recommend. Probably the biggest thing that we add, and so none of these are paid for because this was just recommendations to HSCR, is thyroid screening. And so one question here in the Lower Cape Fear, knowing that half the people exceed 20, and that's not with our new chemicals, and it's expensive to measure PFAS, should just testing for TSH become part of routine care in these communities that we know have really elevated? So that's really the big difference, because kidney cancer, except for blood and urine, is very difficult to identify, and maybe encouraging patients over 15 to get tested for testicular cancer because they are particularly not enthusiastic to do that. So, so very few, because the data aren't very strong. And part of what the panel did was spend some time trying to make decisions in all this uncertainty. We don't have task force recommendations. And so that's kind of the background for that.
I have a couple of questions, but I'm going to yield the floor to others' questions on either the Gen X study, the results that we saw, or the path forward, or the NAS recommendations. Looking around. I'll ask mine, and then it might be one for Franny as well. The DEQ's been on a strategy of synthesizing all the exposure data they could find in surface water, groundwater, fish, human samples, and then looking at the subset of those for which other entities like EPA was going to derive health guidelines, and then looking at a subset of those that were important in North Carolina for which others weren't going to derive health guidelines, but for which we might have data. And that took us to PFMOAA. But I was wondering about Naphthalene byproduct too. That's not one of the ones that EPA is going to derive. It does seem like one of the ones for which there's epidemiological information and some lab study data available. And we've seen again now measured in North Carolina. So could you speak to what the future is for like a health advisory guideline that, as far as what you're hearing? And then I'll ask, I guess, Franny the same thing.
So what I can say is that Naphthalene byproduct 2, we know has a half-life of about a year, which means that it's very persistent, so longer lived than PFHXA or PFHPA. And I think that, given and one of the challenges will be that it's a byproduct, so it's not coming from anywhere else except the people who are making Naphthalene and discharging Naphthalene byproduct 2 to the river. But I do think for those communities, because that's the chemical that we're most likely to measure in the blood of people in Fayetteville, and also and we see correlations in the well. So we don't see the low molecular weight in people's blood in Fayetteville, and then the higher molecular weight is not likely to have been transported in the air. So I think that it's worth considering.
So the data may exist for it, but I hear you saying that it could be that it's, although worth considering, maybe already addressed at the source through other remedial mechanisms, because it's not ubiquitous.
So I think it's probably unique. So, but I do know that there are studies in China that have been measuring it, but I don't know much about those.
Yeah. think it was one of the compounds that we heard from Justin Conley when he talked to the board. And my other question then is, I saw, a future study is going to look at correlation between the PFAS and biochemical parameters. Has any of that been done with the data set previously? We spent the morning looking at a study from 3,000 data points in China at a fluoropolymer facility where they had blood samples for 13 PFAS type compounds and then 13, I think, routine biochemistries. But has that been done previously to this data set, or is it only forward looking?
So the cholesterol sample was that. We are looking at AST and ALT or liver enzymes, and we do see some signals with ALT. And after we get all of our report back done, I anticipate us submitting a lot of papers. So, and then we also see some evidence of an association with hypothyroid disease and in Wilmington, but we're about ready to submit that for publication. So we are data rich, and so now we are hoping to get analyzing our cross-sectional data as well as our longitudinal data. We have about 200 of the original 500 people who participated in the follow-up, and so we already have some repeat data, and so soon we'll have more. So we are trying to do some of that at the same time, but we are at grievance, so
Yeah.
we're trying to keep everything moving.
Yeah, I realize it's forward looking, and that's one of the roles the board has played. And what we were doing this morning was, we know there's data on the horizon. We know there's some data available now. What's the recommendation back to the state with the data in hand versus waiting a little longer? I was just wondering whether there was other correlational analysis between blood biochemistries and the data that were available now versus pending.
Yeah, so that's where we are right now. Yeah.
Okay, thank you. Others? Go ahead, Dave.
So Academies used a simple additive approach, right?
I'm sorry.
Academies used a simple additive approach here, right?
So we just use, so these are actually values based on the German human biomonitoring network studies.
Right, but they were a simple additive approach if I read the footnote.
Yeah.
So the reason I'm asking the question is, the question that we've been faced with as a board is how do we deal with the complex mixtures? And so does your approach maybe inform the risk assessment should also be considering doing simple additive approaches for looking at complex mixtures when deriving water standards?
So I think take a step back, because I think that so HPM2 only looked at PFOA and PFOS. So they made two numbers. And then EFSA has a sum of 4, but I don't know that there's been good work at trying to sort out really how to handle that, because everybody's exposed to a mixture, and you're measuring people's blood today, and we don't know the past. So, and most of these are molecular weight is relatively close together. So if you just simple adding them up or adding them up on molar weight, it might be a way to go. But then I'm sure the toxicologists and you, some of them will what's the relative potency of
Right,
these
but I guess
chemicals.
part of why I'm bringing it up is that there was not a potency equivalent in the way the approach Academies used. It was a
Right.
simple additive approach. So you would have had to justify that as far as the rationale of using an additive.
So partly we were also not allowed to look at the toxicology literature. So we were really focused on what has other, and I would look at what EFSA has done, because we based a lot of our summing based on that.
Anyone else?
Well, visit our website. We'll have more up there soon.
I do have one. Sorry. So you mentioned that you didn't just measure any Gen X because it was probably eluded too early on.
No, Gen X was gone.
It was gone.
It was
Okay.
gone. So the half-life is about 3 days. So 5 half-lives is complete elimination. So we were, it would have been long gone 5 months
Okay.
after.
I thought it was an analytical issue, not a.
PFMOA is that.
Okay. Thank you. Sorry.
Not at all. What prompted you to start in 2017, considering Gen X as being made for the last 40, 50 years?
So no one knew it was in their drinking water until June of 2017. So really it was Detlef's work with Mark Streiner and Annie Lindstrom, that was published in December of 2016, that showed that Gen X was not only in the river, but also in the finished drinking water for Wilmington. And then about 6 months later, Wilmington woke up they saw articles in the newspaper to find out they had been drinking Teflon for 40 years. And so that's, so we came in at that point. And so I think that we still have to work on answering the question about 40 years of potentially 700 parts per trillion of Gen X, and what does that mean? But we're not going to be able to measure that with a biological marker.
So when you say half-life is 3 days or so, that's a half-life in the body, or that's the half-life in the atmosphere or in the
It's
environment?
half-life in the body. So that was some work that was conducted among workers at the Chemours plant in the Netherlands, so that they calculated out, and that's in the EFSA guidance. So it's 81 hours, but the other things are days. So Gen X is among the shortest half-life of the chemicals, but I don't know about some of these other ones.
So of all these chemicals, isn't there some bioaccumulation in the human body?
So Gen X does, so I would say with a short half-life like that, but so PFOA and PFOS have half-lives in the nature of 2 to 5 years. And exposure is ongoing, which is why older people tend to have higher concentrations. Interestingly, PFHXS seems to have the longest half-life of all. So that these chemicals do persist. So because people have continuing exposure, and so we're not just eliminating them, we also have continuing exposure, that they are bioconcentrating. But just like we see in the NHANES data, when the inputs to the environment through consumer products come down, the levels in us come down. So we would expect that people who, and we do show this, we have some other work where we're looking at what factors are associated with levels of PFAS in blood. And we do see, particularly for all the fluoroethers, that the number of years you've lived in Wilmington drives that. And we also adjust for years in other places as well. But so there's some challenges to thinking about all of these things, and particularly all the chemicals that are discharged to the wastewater, because if we start to think about, or to the air, if we start to think about modeling exposure, then we lose any level of individual chemical resolution, because we know it was all this soup of other things.
And one last question, if I could. There are multiple pathways for this family of compounds to enter the human system. Which, in your judgment, is the most important? Is it water, air, food?
So if you drank water that was sourced by the Cape Fear River, I think it's drinking water. I think when we start to look at the relative contributions of food and consumer products, if you don't have this big high exposure from water, then those might be important. But even if it's in your water, you might be showering in it too. And we don't know a lot about whether inhalation is important or dermal exposure. We also, in Fayetteville, we had people wear wristbands, the silicone wristbands, and so we were able to detect Gen X on the wristbands of people. So I think the relative contribution depends a lot on the state of your world. And so if your water is contaminated, a pizza box is probably not going to be a major contributor, but I think in lots of the US where they don't have high levels of PFAS, that there are other sources which are super complicated. Like if you look in the National Academy report on the recommendations for reducing exposure, we make recommendations about avoiding water, workplace, if you're a firefighter, work with textiles, contaminated fish and game. But then you end up just like stymied thinking about everything in our environment, raincoats, shoes, carpeting, makeup. And none of those things happen individually. And so, microwave popcorn. So there was nothing clear to say, if you stop eating microwave popcorn, you will have, these will lower your levels. And so I think in the baseline so if water was out of the picture, then we could spend a lot of time thinking about those consumer products. But I think that the most effective way to bring it out of consumer products is to stop putting them in consumer products. Because that's what we saw with PFOA and PFOS. So, because, how much, it's in dental floss and all these different chemicals are in many different places. So if we can reduce those exposures, because they're not on our label products. So that's kind of my horse that I'll get off of now.
Well, thank you again for the Gen X summary and the NAS summary. The presentation will be posted on the board's website, and thanks for including some of the links in there that people can follow for more information.
Thanks. Thank you.
We're going to move on to the revisitation of earlier items on the agenda, which were updates from Dr. Franny Nielsen on the consent order studies that are being done by, in conjunction with Chemours. And I guess we'll start with that one, and then we'll move on to one for an update of the PFAS accumulation in fish study. If it's easier for you to start with the other one first, that's fine. It's up to you.
Okay. Yeah, it doesn't matter to me. They're both mine, so. This is mine. That's right. Yes. Yeah, let me make the slide before me. Yes, it's perfect. Okay, thank you. Okay. So hello, everybody. I'm going to give you a quick update about the current status of the consent order toxicity studies that we talked about last time. This is really just an update of what has changed since the August meeting. And so just for a quick refresher, the 5 PFAS that are included in the consent order, paragraph 4, toxicity studies, are these 4. They're PFMOAA, PMPA, PEPA, PFO2HXA, and then naphthenol byproduct 2. And these 5 compounds will be examined in these different studies. And so they are rodent toxicity studies and the ecological toxicity studies. And as far as the rodent toxicity studies go, just for a refresher, we're doing all of these studies in mice and rats, both 90-day repeated dose oral toxicity studies, and then also 28-day oral immunotoxicity studies. We were doing, the consent order requires Chemours to do these studies. The ecotox studies pretty much range the different methods of accumulation through the environment. And so they start with the sediment toxicity studies, which is worms and sediment. Then we have algae, Daphnia, both chronic and acute studies, and then also fish toxicity studies. This is the timeline from the August 1st meeting, and so this is what you saw before. Just to make this a little easier to look at, we have the aquatic toxicity study information in green, and then the rodent tox information in the pink. For each draft of these protocols that DEQ has reviewed, we have the initial date that we received them, and then any meetings or comments or anything like that, communication we've had with Chemours regarding that study, that draft of that protocol. And so where we left last time was that we had received, under the 4th/final question mark draft, we'd received the plankton and sediment protocols, and they were under review. And so we received those at the end of July and had reviewed them through August. And what has changed is that we sent comments to Chemours in late August regarding these studies. Our intention was to approve them at that time, but there were some changes made to those protocols that led us to have some more questions about those changes as to why they were made and things of that nature. So we sent comments back to Chemours, and we're waiting to receive a response or a revised protocol. So that's the status of that currently. This is another slide that you saw in August. And so just to give you this kind of look, these are the 5 aquatic toxicity or ecotoxicity studies. 2 of them have been approved, and so the algae and the fish protocols were approved earlier this year, and we're waiting for the timeline for the contract lab. In August, we received the revision, but we were pending the review. And at this point, we have reviewed the revision, and we've sent comments, and we're waiting for a response. As far as the rodent toxicity studies go, this is the slide from August, and so we required a revision, but we had not yet received it for any of these 4. And that's the same status today. We have not received any revised protocols for these rodent studies. As far as our timeline or proposed desired timeline moving forward, through the end of the year, I'm hoping to meet with Chemours about those 3 aquatic toxicity protocols we had some questions about, and then hopefully receive revised protocols and approve them by the end of this year. I'm also hoping to receive and review the revised rodent protocols. We're waiting for Chemours on that, and then to also submit comments to them before the end of the year. Early next year, I would really like to approve them, and so I'm hoping that the revisions are appropriate, and then to also receive timelines and work plans for all of the approved studies to begin. Yeah, that's what I would like to happen. I don't know that that will in fact be the timeline, but that is, if I could have it my way, that's what would happen. But that's all that I have on that. It's just a quick update from last time.
Thanks for the update. Is there any information needed from the board, or is it just informational?
This is just information.
Okay. I'll pause for a couple of questions before we move on to the next one.
Just a quick question about the rodent test. So that you sent comments back in March and you're still waiting for a response and reply. Do you have any sense of what the holdup is?
I don't. Do you have any sense of what the holdup is?
No, they're not pointing out any particular issues with responding to the comments that were provided.
Yeah, Michael Scott with Division of Waste Management. We met with Chemours last week, and we're expecting responses near term and updates to include on the rodent studies,
Okay.
but I don't know specifically what the holdup was there.
Okay.
I think we've discussed with Franny and Assistant Secretary Maysmore, who can't be with us today, that these protocols are a priority for the department. We've honestly been going back and forth with critical input from Franny and others on getting them right so that they don't move forward in a manner that's not productive, meaning the end results that are produced. But to your question, we hope to have a more substantive update based on Commora's response from last week, very near term.
Okay, thank you. Anything else? All right, thank you for the update. Let us know if there's anything that we can do to be helpful on that. And then the last topic before we get to the public comment section is an update on this summer's fish tissue collection work, which Franny introduced earlier.
Okay, so this is just another quick update from the last meeting on the status of our water and fish collection study that we did this summer. So just to refresh everyone's memory, this fish and water collection event that we did in the summer of this year was a very large collaborative effort between DEQ, DHHS, and the North Carolina Wildlife Resource Commission. As far as what we're looking for in the fish and water samples, this slide I've shown a couple times, but we have them separated by the EPA roadmap compounds and then the PFAS that will not be evaluated by the EPA. And these are the top 20 or so PFAS that are represented in almost all of North Carolina's media that we have sampled. Okay. And so this is a map of our study, which is the Cape Fear River. You can see the big gray shape in the center of the map, that's Fayetteville. And so we started sampling south of Fayetteville, right around the Commora's property boundary, and we sampled the lower 200 kilometers of the Cape Fear River. The Cape Fear River was divided into 10 20-kilometer sections, and each of these sections was sampled for water and fish samples, so we can derive bioaccumulation factors that are specific to North Carolina and the species that are most commonly consumed in the river, which is downstream from a known point source. Since the river does span a very large part of our state and there are different ecosystems inside the river, we're sampling different species in these places. And so it might look like the site numbers 10 to 1 are a little backwards, and they're done that way because they follow the river kilometers, which go from 0 at the confluence with the Atlantic Ocean up to 200 right by Lock and Dam number 3. And so that's why 10 is at the top. But from sites 10 to 4, these are the freshwater sites. And so we're sampling these species of fish at these sites. They are largemouth bass, bluegill sunfish, red ear sunfish, flathead catfish, and blue catfish. So 5 individuals of those species will be sampled at each of these sites. The 3 species on the right side are American shad, striped bass, and channel catfish. These are sampled more opportunistically at these sites because these are more transient species and they're not always in the same spot. Whereas the species on the left side are, they have a higher site fidelity or smaller home range, so they don't move as much as American shad or striped bass. The American shad are also an interesting species to look at for this because they breed at the top of the river and then they move down into the lower sections 4 or 5 in the summertime. And so they can tell us a lot about long-term exposure and accumulation through different generations. The striped bass are an interesting population as well. Their fishery is more or less collapsed in the Cape Fear River. And so they are restocked annually from a hatchery. And so those fish are known genetically to the Wildlife Resource Commission, so we know exactly who they are and where they're from. But that also will tell us a lot about short-term accumulation, so in a season. For the bottom 3 sites, these are the estuarine and saltwater sites. We're collecting different species because it's in a different environment. And so these species are the striped bass, southern flounder, speckled trout, black drum, red drum, and sheep's head. And so these species are not all being collected in quite the same way. We're using passive sampling to collect these, and so these sites are still not totally complete, but we're working on it actively, and it is happening. As far as collection and processing goes, this is a large effort and included a lot of people, and so we were electrofishing throughout most of the Cape Fear, bringing the fish back to the lab and processing them in a PFAS-free methodology. You can see at the top right is Jeff DeBardinas, who is processing one of our target species, and the bottom right is Kyle Rachels with the Wildlife Resource Commission, and he spearheaded a lot of the fish collections. We could not have done this without him. As far as our sampling progress goes, the words are a little small, I guess hard to see, but we've fully sampled the freshwater sites in the river, and we're working on finishing the bottom 3 sites. The update from last time is that we've processed site 10, and so that is the site closest to the Comores boundary, and we have sent those off for analysis. I was expecting the data last week, but because of the hurricane, the lab in Charleston, I believe, was shut down for most of the week, and so I'm expecting it any day now, and so we should have that data, and then we're on the calendar to process the rest of these sites and these fish and send them to the lab to get data. So we're hoping to have all of this data compiled by the end of the year. As far as our estimated timeline goes, we're in the data review or sending for laboratory analysis pieces right now, and yeah, we're at the stage where we're just homogenizing the fish and weighing them and sending the subsamples to the lab. And so, yeah, that's where we are. That should be finished this month if all goes according to my calendar, and we'll have the data by December.
What's the timeline for the water samples getting
Oh.
back so that you could do your site-specific bioaccumulation factors if you chose to?
They're being sent with the fish, and so the same timeline. We have, every time we've collected fish, we've collected water from the exact same place in the river that we've collected the fish from. So we have more than one water sample for each of the sites. They were done daily, and so if it took us 2 days to finish sampling a site, we have 2 water samples. Some sites we have 3 or 4 or 5, depending on how easy or not it was to get all the fish. But those are being sent, the site-specific water samples are being sent with the fish from that site to the lab. So it'll all come back as kind of one package per site.
Mm-hmm. In an ideal world, when will you have both water and fish tissues back from all of it? Like, best guess, this calendar year or?
That is what I'm hoping for. And so it takes
Okay.
about 3 weeks for them to process it from the day that I send it to them. And so if we continually send them data, I'm hoping we'll be receiving it through early December. If all things go according to plan.
Great. Is there any need from the board or a request or just an update?
Just an update right now.
All right. I will pause and see if there's any questions for Dr. Nilsson.
I actually want to pick up on the point you just made, is that it seems that the number of samples you've got at the co-located water, you'll actually be able to have the data available to do the bioaccumulation factors for all these fish within the Cape Fear River, right?
Yeah.
That's great. Yeah, I mean, there's a huge effort, so I think that's a great outcome as well. I mean, that's the first issue we dealt with, but this seems to me like within perhaps early next year, you would have the ability to do that. Is that right?
Hopefully. And so when we went through the EPA values from the aquatic life criteria, there were several reasons. And one was to see what to expect from the fish that we are sampling ourselves, and what perhaps our surface water standards could be, and also to see how different our data is from the federal data.
Yeah.
And so we're looking at it 2 different ways.
It seems superior to the Canadian data that was being discussed here, if I recall correctly. I think this is great. So good work. Yeah.
Anything else? All right, thank you, Franny. That moves us to our last order of business, which is the public forum. I believe, and unless anybody else has signed up to speak, it was Mike Waters who had signed up. So let me just check and make sure there's nobody else. Can you look at the list, Paula? Okay, thank you.
Hello, I'm Mike Waters, Fayetteville, North Carolina, Grace Creek resident, United Against PFAS in our wells and water. And it's actually North Carolina too now. We took in the other 4 counties in the Wilmington Basin to help those water use. For the PFMOAA, we are hopeful that you will get a reference dose for that, give good guidance, and we remind DEQ that right now it should be the practical quantitation limit is what should guide that under North Carolina standards. One of the things that I wanted to present to you guys is I have a granular activated carbon system again on my property. Thank you, Mr. Scott. He helped immensely to get that reestablished because I have polycythemia. That term that Jane Hoppin just used, that is the second time I've heard that in 10 days. I have that too. And I'm convinced it is from the water because so did my dogs. You know, what's the odds of a dog having that? You know, 3 huskies, all of them died of pancreatic cancer. You know, so I'm concerned. You know, you asked a question of the bioaccumulation. I know I grew gardens, 2-acre gardens, and we ate a lot of the food from there. I would eat 6 to 8 cucumbers a night, tomatoes on the growing season. From 2017 up till last year, well, this year, I didn't have a garden. Got the GAC system in. We were hopeful the air was less, which it's not. You know, they report 99.99%. When Fran Minshew, northeast of the plant, 1.18 miles from that stack, has 20 chemicals showing up in a dry catch, and then she has PFAS at 199. You look at the 5 sites around the facility that catch rainwater and dry air. If it's not in the other portions and it's only in her direction, it's coming from that plant, and that's PFAS. They claim PFAS wasn't used at the facility. It's not there, yet it's in the groundwater. And I'm betting money it's in the shipments coming from the Netherlands. So, you know, I challenged DEQ to look at those shipments that are coming from the Netherlands. It's hazardous waste there. I do have a public records request through Netherlands personnel to try to find out what's coming as hazardous waste from them to unregulated stuff to be recycled at Chemours. Recycled in their terms is disposed of in our terms. You know, and why am I concerned? Okay, in my water, by the consent order, they're only required to test for 12 chemicals. I have as many as 20, depending upon what day of what week you test. And I know what's coming down in the air. I'm lucky right now because the wind's from the Gulf Coast northeast, so I'm not getting it. Here in a week or two, when it shifts, I'm going to start seeing what Fran was getting. In the groundwater, just for 9 chemicals, because they're only ordered to test for 12, I have 1,047 combined PFAS. If you add in the other ones under the full EPA study, I'm close to 3,000 parts per trillion. Now, would you water your garden and eat cucumbers and watermelon and stuff from a garden watered with that? I was watering with the granular activated carbon system. It caused the iron filter to collapse and the sediment filter. So now I'm retesting the water to find out. That 1,047, the GAC system removed everything until I probably collapsed the iron filter in there. So, you know, I'm concerned on that. I am going to find out. I was a liaison to the National Academy of Science study. Very happy to do that. And I'm happy to see Jane Hobson's study and the data. You know, all I ask is give very good guidance to DEQ and lead them, because apparently they can't lead themselves. Thank you.
Thank you, Mr. Waters, for perspective, as well as for your concerns and for your recommendations. No one else did sign up for the public comment section, so that moves us to the end. I'm going to remind you that the next meeting of the board will be December 5th. And I'll poll people to see whether that meeting will be in person or virtual. I've heard that there could be the option for both, as that this space is going to be remodeled, sounds like. So maybe there'll be the option for dual participation. And, we'll revisit at least two things then. The two items that were teed up this morning, PFMOAA. I think we're very close on that one. There'll be a draft document to review. Maybe we'll just be doing the final edits of that. And then, of course, we can have a deeper dive on the issue that just got teed up at this meeting on the bioaccumulation factors, the review of EPA's data as a foundation for those. And Franny and I will take care of circulating some other background material that we mentioned, the state's homework on that, so that you can see what data they kept, what data they called, and why. So those will be the at least two main topics, and maybe others between now and then. I wanted to thank Paula for logistics, and Peter for IT support, and Franny for work on the agenda with the DEQ and DHHS leadership. It'd be appropriate to entertain a motion to adjourn. Moved by Dave. All in favor? Aye. Thanks so much for your participation. We appreciate it.